Hi, my name's Janelle. I'm from PACOP, and today I'm bringing to you the last in a series designed especially for care staff, all about the symptom assessment scale and helping care staff to monitor distress in residents. This one is about monitoring distress from other symptoms. It's the final one in the series of SAS for care staff. The symptom assessment scale is just one of a suite of validated clinical assessment tools used in the PACOP model of care. It's really unique in that it is resident rated, so it asks the residents about a range of symptoms that might be distressing to them, and it's really about enhancing their quality of life. PACOP has developed a range of excellent tools to help you get the right SAS scores with your residents. One of the first ones is the SAS ruler. It comes in a small and a large size, and it's a great visual aid to use to help residents tell you about their distress from a range of symptoms. It has a numerical scale for them to rate their symptom distress, and it also has a visual aid of the colours and the faces. It's a great tool for residents where English is not their first language, or residents where speech might be an issue as well. The other tools we have available are a guide for residents. It's called Your Symptoms Are Important to Us, and it helps residents to understand the SAS tool and be able to score it themselves. And of course, we have the SAS tool where residents can indeed put their own scores down if they wish each day. All of these tools combined, as well as the education tools we've provided for staff, make a really good package to help you get the right SAS scores. When you're thinking about other distressing symptoms, there's a couple of tips you need to remember. First of all, remember that when you're rating other symptom distress, it's anything over the past 24 hours. When you're asking about distress from any other problems, remember it's about the distress that the symptom is causing, not the symptom itself. So the resident may be experiencing itchiness or all over their body. They might be feeling exceptionally sad. They might be feeling lonely. These are all things that can be seen as other symptoms. But make sure you ask how much it is bothering them, or how much it's distressing them, or how much it is worrying them to get the right SAS score. And how to find out? The best way to do it is to have a chat while you're doing your routine care. Don't just stand there and go, have you got anything else wrong? What you want to do is say, while you're doing care, you might notice that they have marks on their legs from scratching. So you might say, wow, I noticed you've got some marks on your leg. Have you been itchy? They might say, yeah, I have. I've been scratching all night. Oh, does that worry you? Does it keep you awake? So you can talk to them through a conversation to find out how much other symptoms are distressing to them. Whilst we know that the gold standard for the SAS is that it is resident rated, we also know there are many times when we need to do proxy scoring, and that is scoring on the resident's behalf. So staff members can proxy score, family members can proxy score, so long as the person who's doing it has a knowledge of the resident, because you actually need to know what the resident's usual behaviours are so that you can say to yourself, are they different today? There's something not right today. If you don't know the resident, make sure you do find someone else who does, a family member, a friend, a co-worker or a carer, because you need to always score from the resident's point of view so that you're not scoring things that might be distressing to you. You're scoring things that you know would be distressing to the resident. If you're trying to get across to the resident, you need to also use words that are familiar to them. So distress might not be familiar to them, but words like bothering, upsetting, worrying might be more familiar to them. Finally, use your SAS score guide for the other 7 symptoms to make sure that the symptom you're measuring today doesn't fit into one of those categories. If there is another distressing symptom, make sure you not only score it, but you write down what the distressing symptom is so they can ask about it again the next day. And you can get the right referrals in place to manage the symptom and help the resident have better quality of life. So there you can see some symptoms listed there that would fit in the other category. So remember, we talked about a symptom as something that's distressing experience in either the body or the mind. So we include things like sadness, depression, agitation, confusion, aggression, but we also include things like itchiness, or maybe they have a non-healing wound that's distressing to them, or maybe their mobility is decreasing and that is distressing to them. So think outside of the box when you're thinking about other symptoms for improving quality of life in your residence. Finally, as care workers, we always wrap up monitoring distress with the SAS by using the 3 R's. First of all, record the scores, either on the SAS form or on whatever system you're using in your aged care home. Secondly, use the ruler. The special care staff SAS ruler has an action plan on the back, and you will know immediately which action to take. If the score is absent, you don't have an action to take. If the score is mild for any symptom, then you need to report that to the RN or your supervisor within the shift. If the score is moderate, you'll need to report that again within 30 minutes. And of course, if scores are severe, you want to report them immediately. So you might have one symptom that is severe and the rest are absent. You still have to report that one symptom immediately and report all others that have a score with them as well. So that helps you cover all your bases and ensure that the resident is going to have maximum quality of life and care for the distressing symptoms. Well, that's a wrap. Thanks for watching. This was part of the Care Staff series of PACOP Clinical Bites for the Symptom Assessment Scale. Make sure you check out our other videos on PACOP YouTube channel, or if you want to know more, you can contact us, send us an email at pacop@uow.edu.au. Thanks for watching.